nodules are very common. About 30 to 50% of the adult population can have thyroid nodules. Most nodules are benign, meaning they're harmless. However, about 10 to 20% of nodules can become cancerous at some point. In order to figure out whether a nodule is cancer or not, the best procedure is to perform a thyroid nodule biopsy, which is also called an FNA or fine needle aspiration, because a fine needle is put into the nodule, typically under ultrasound guidance, and some cells are taken out and examined under a microscope by a pathologist to see if there are any features of thyroid cancer present. Now, there are a number of different results that can be obtained from a thyroid biopsy. One of the pathological results that you can get is benign, meaning everything looks harmless there. Another is malignant, meaning there is evidence of cancer there, in which case a thyroid surgery is typically recommended, where either the entire thyroid gland or half the gland is taken out. Now, it's not to say that every biopsy that comes back saying that it's malignant is necessarily malignant. Sometimes the biopsy will show a malignant result, but the end result will be that it's benign, because the tests are not 100% accurate. However, when that type of result is obtained, our usual course of action is to recommend surgery. Other results that you can get are indeterminate results, and they come in a number of different forms. One is non-diagnostic, meaning that you underwent an FNA, however, not enough cells came out during the biopsy, or something else happened with the sample and a reading could not be obtained. Other results that you can get are called atypia of undetermined significance, or follicular lesion of undetermined significance, or follicular neoplasm, all of which fall into this indeterminate category. Now, the chance that these types of results in this indeterminate category, the chance that they are malignant ranges anywhere between about 10 to 40%. Now, the thyroid biopsy procedure itself is usually done in an outpatient setting in an office, and it takes about 5 to 10 minutes. Anesthesia is usually not used nor required for the procedure, and in terms of the amount of discomfort felt by the patient, it ranges anywhere from the amount of discomfort you might experience when blood is drawn from you to higher than that. And the amount of discomfort that you feel will depend on your individual pain threshold and tolerance, as well as the size of the nodule, the technique that's used, the experience of the person performing the biopsy, the location of the nodule, whether if it's more superficial, closer to the surface, or deeper down, and its proximity to surrounding structures such as muscle. So if a thyroid biopsy is performed and muscle needs to be penetrated or is hit, that procedure might be a little bit more uncomfortable. Typically, within a few weeks of having the biopsy procedure done, your results will be available and you can discuss it with your doctor at that time.